The first intervention is never the last. Experienced nurses know that reassessment tells you whether your treatment is working or whether your patient is getting worse. 15 minutes after treatment, the nurse checks another blood glucose. The reading shows 88 milligrams per deciliter. Your blood sugar has improved. How are you feeling now? Excellent. Now let's keep it from dropping again. If the patient is fully alert and can safely swallow, the next step is to provide a snack or meal containing longer-acting carbohydrates and protein to help maintain blood glucose. Meanwhile, the patient with hyperglycemia has received IV fluids and is feeling slightly better. Now the nurse reassesses everything. Your breathing looks easier. Has your nausea improved? Good to hear you don't feel as thirsty. The nurse reassesses vitals and reviews lab results. The blood glucose is improving and ketones are negative. The patient remains stable. Doctor, room 8's repeat glucose is 88. Mental status has returned to baseline. Room 9 remains stable with IV fluids. No signs of DKA at this time. Excellent. Continue monitoring. If both patients remain stable, we'll begin discharge planning. Team communication is vital for patient safety. Treatment doesn't stop when the glucose improves. Education prevents the next emergency. Let's review hypoglycemia prevention. Today your blood sugar dropped because your insulin and food didn't match. Always eat after taking insulin. Carry fast-acting sugar and know the signs. If the person is awake and can swallow, give juice or glucose tablets. If they are unconscious, call emergency services immediately. The patient with hyperglycemia also needs education. High blood sugar usually builds over hours or days, not instantly. Hydration is key. Drink fluids as directed and take your medications exactly as prescribed. Know your sick day plan and contact your provider if glucose stays elevated. Most of the time, the body gives warning signs: extreme thirst, frequent urination, fatigue, blurred vision, and increasing weakness. Not every patient needs admission. The team checks if vitals are stable, glucose is improving, education is complete, and follow-up is arranged. But persistent confusion, DKA, HHS, or unstable vital signs may require hospital admission for closer monitoring and intensive treatment. Let's put it all together. For hypoglycemia, think sugar first and reassess. For hyperglycemia, assess, hydrate, and monitor per the plan. The best nurses don't memorize numbers. They recognize patterns. Your assessment and clinical judgment change the outcome. Bye for now. Thank you for watching the Nurse Scrub Club. Like, subscribe, and join us next shift as we break down insulin types made simple. Bye.